Health and Family Services puts up some monster budget numbers. $7.7 billion for fiscal year 2011 and $8.3 billion for fiscal year 2012. It's about 28.6% of the entire state of Kentucky budget, and its largest single amount, about 5.3 billion comes from the feds. And just like education and workforce development is a euphemism for unemployment insurance, Health and Family Services is a euphemism for Medicaid. The Medicaid and S-chip covered, that's about $5.6 billion. And just in case you wanted to know what you get for your Medicaid dollar, following services are covered: inpatient hospital, physician services, nursing facility services, outpatient hospital, home health, family planning, screening, lab, dental, transportation, both non-emergency and emergency, vision care, hearing care, intermediate care facilities for the mentally retarded, pharmacy, Medicare premiums, community mental health, mental hospitals, psychiatric residential treatment facilities, renal dialysis services, primary care / rural health, podiatry, alternative intermediate services for mentally retarded, brain injury waivers, ambulatory surgical centers, home and community-based waiver, adult daycare, nurse, midwife, nurse anesthetist, hospice, preventive services, targeted case management, school-based services, home-based services for children who are ventilator dependent, durable medical equipment, portable x-ray, nurse practitioners, chiropractors, and other medically necessary diagnostic and treatment services for children in the early periodic screening, diagnostic, and treatment program. It would have been easier if they just said what they didn't cover. Now, I'm not going to talk about Medicaid structural flaws. I talk about that in some of the research I did on YouTube when we were talking about the Healthcare Reform Act. But I have two main issues with this. And the first is that it seems like it's just like education, and that you had this huge multi-billion-dollar pool of money for a generic topic, a generic purpose, education or healthcare for the poor. But when you go through the budget, you start to see hundreds of millions of dollars additional for programs that appear to be very similar, like screening, rural healthcare, or community homes. Why is that? The other item is that, all those services, that's a lot of coverage. And then you add to that our other programs for the poor, like temporary assistance for needy families, supplementary nutritional assistance program, Section 8 housing, public school, free or reduced lunch, subsidies for heating bills, public bus fare, and phones. Well, are these programs actually ending poverty, or are we keeping poor people poor? Are we caging them like veal calves?